Ladies and gentlemen, if our sound is ready, yes, we are going to stand up on our feet, recognizing our national anthems. We start with Uganda first, and then we shall have the Eritrean national anthem. Thank you so much.
Oh, Uganda, they gotta hold me. We lay our future in thy hand. United we for liberty, together we'll always stand.
Thank you, thank you, thank you. Can we clap for ourselves? When the Eritrean community in Uganda, they were suffering from different sicknesses. They were looking for services from the nearby local hospitals, but they were facing a problem of the language barrier. Now these two, Mr. Asmelesh and Mrs. Helen, they brought in this idea from the community of the Eritrean people. So this hospital, it is a community hospital from within a community of the Eritrean people. They came in with the idea to treat the Eritreans, and we want to thank them so much. I can see the turn-up shows that you people, Mr. Asmelesh and Mrs. Helen, you thought of a God-given idea. We pray the good Lord protects you and keeps you under his divine protection. I want to thank the Eritrean community for respecting your hospital. This is a hospital from within to serve you. Thank you for honoring the invitation of today to also come and donate this blood. It was started in 2018. If you count closely, those are like 6 years down the road. They are serving people. Yesterday we spent here the whole day. We had a meeting with them as the Hepatitis CS Consortium. And people were coming. They attend to them with a smile. Thank you so much, Mr. Asmelesh and Mrs. Helen, the CEO. Lastly, allow me to thank in a special way the Eritrean community for respecting and also loving the hospital. We, the Ugandans, we have learned to love our own from you. You love yourselves to an extent of even blood donation. Doctor, these people are not forced. It is within their culture. I pray all Ugandans, we can now copy this. Really, it's a very good idea. They are coming in big numbers and they are still coming. They will come until the close of the day. The Eritrean community, can you please kindly clap for yourselves? Thank you so much. I'm going to be working with Mr. Absalom, the manager of the East African International Medical Center, is standing here with me. He'll be helping me here and there to help us go through the program properly. Allow me straight to first welcome Mr. Absalom to have a word to you. Thank you so much.
Thank you very much. Thank you once again for coming and donating blood. This is a very unique culture that we have inside us. So I'm very happy to be an Eritrean. So it's a glad, it's an honor. And as part of the community blood group, I'm working since 2022. The blood donation program or the campaign was started on 2021 by some volunteers to have or to give the blood to help those who are in need. So from 2021 until now, the donation program is coming now and then it had a good number. From 2021 up to now, the blood accumulated or the whole unit blood accumulated is like up to 530 units. This is a good number. We shall be proud of this. Let's clap for that. Yeah. 530 units whole blood, and some are sent to Mengo Blood Bank. And thanks to Mengo Blood Bank for helping us and organizing the program to work. This couldn't happen without them. So thank you very much on behalf of our community. There is medical director from Mengo Hospital. Thank you for coming and thank you for your help. And I'm also happy to say thank you for KCCA and Ministry of Health for helping us and to organize such program. This is an honor for us. Thank you very much. On behalf of the Eritrean community, we thank you. We are glad. Thank you very much. There are representatives from the Ministry of Health. Please clap for them.
Yes.
Thank you very much. Thank you. Thank you.
Thank you.
Yeah, and we have invited some other guests from UNHCR, AHA, and also the police department, but I don't think they are around. But on behalf of the Eritrean community, we shall say thank you and please warm clap for them also.
Wow.
Thank you for everything, who donate. Thank you who organize. Thank you for those who come with their will to donate blood. Thank you very much once again. Thank you. Let's proceed.
Thank you, Mr. Absalom. Can we give him a big round of applause? The message was very clear. We want to thank you so much. A brief about the East African International Medical Center. We offer the following services. We offer general medical care. We also have the pediatric services. Our laboratories, ladies and gentlemen, this is a very clear innovation. The East African International Medical Center is accredited by the KCCA, the Gulf Cooperation Council Hospitals. It is on the list. Attaining that status itself, I want you to join me and we clap for that team, the founder team. That is Mr. Smilesh and Mrs. Helen. Thank you so much. Our laboratory is also approved by the Allied Health team. We want to acknowledge that. And they also have the ultrasound services. They're very clear. The OPD and the IPD management. They also do general surgeries. The pharmacy is good. They also have the dental services. The dental section is there up as you enter on your right. I think the first room. Name it and name it. The ENT specialist care is also there. You have the gynecology and obstetrics, antenatal care, family planning, immunization and vaccinations, the metrology specialist, physiotherapy services, and then counseling. Name it, name it, name it. The East African International Medical Center, they have 3 branches. This one being the main in Kabalagala. They also have another one in Bonga. And then lastly, the last one is currently in Ndeba. They are doing all that to extend services, not only to the Eritrean community, but also to the Ugandan community. We want to thank you for your absolute services you're rendering to our country. Ladies and gentlemen, allow me at this time invite the National Blood Transfusion, the Eritrean representative, that is Mrs. Senate, to come and give us something about your welcome, Mrs.
I congratulate you of doing such voluntarism, altruistic, and good willing in order to extend the lives of the above mentioned people who are in need of your precious blood. The National Blood Transfusion Service of Eritrea established in 2002 and is showing remarkable developments. To mention some, Rh negative and Rh positive blood donors organized in clubs in 2006 and 2009 respectively. These clubs united and established National Voluntary Blood Donor Association in 2013 in Asmara. Currently, the association is extended in all 6 zones. The blood bank introduced quality management system and Delphi IT system in 2008. MTS follow WHO recommendations in recruitment, selecting blood donors, screening donations for HIV, hepatitis B surface antigen, HCV, and syphilis for safe blood transfusion. It is certified to ISO 9001-2008 in 2018 and recertified in 2013 by South African Bureau of Standards. And it working for AFSPT stepwise accreditation or certification. In 2003, the National Blood Transfusion Center collected more than 15,500 blood units, 100% from voluntary blood donors. 46% of the total collection were from regular donors. Regular donors are donors who are donating more than 2 times per year, at least more than 2 times per year. Blood collecting from these regular donors is safe. WHO also recommends collecting blood from regular blood donors for safe blood transfusion. The satisfaction rate of hospitals for their demands reached 83% in Eritrea. To mention some activities of the Eritrean Voluntary Blood Donors Association, these donors regularly donated blood 3 to 4 times per year, helping donor services in recruiting, organizing, and blood donation, educating the community to increase awareness of blood donation, etc. Especially during COVID-19, they were working full-time in the blood bank and the stock level was sufficient enough. There was no any shortage of blood. Voluntary Blood Donor Association is very helpful and is the right hand of the blood bank for saving safe and sufficient blood. For having you, the Eritrean blood donors in Uganda, are doing very good job. I really appreciate your initiatives here in Uganda, your voluntarism as refugees. You are doing fantastic job, helping people, saving lives. It is more than words to say. I will thank the East African medical center of organizing this event, and just say, just continue. It's good job. God bless you. Thank you so much.
Thank you, Madam Senate. Can we give her a big round of applause, ladies and gentlemen? This is something that has interested me. In 1 year, like they started donating blood in 2021 on 17th, that was September. They collected 29 units. In the same year, on 21st in October, the other one was in September. This is now in October. They connected 31 units. In the same year, in December, on 20th, they collected 30 units. People are donating blood in 1 year more than even 2 times the Eritrean community. Allow me thank the Eritrean Voluntary Blood Donors Association in Uganda. Thank you so much. We cannot thank you more. I know that from the bottom of our hearts. We want to thank you lastly, the people who are donating. Thank you for loving life. We are only donating because we all know that human blood saves human beings. And you're spearheading this caravan. We want to thank you so much. At this time, allow me to invite in Mr. Daniel, the representative of the Eritrean Voluntary Blood Donors Association in Uganda. Kindly please step forward and give us, we can give him a big round of applause as he's coming. Thank you.
This is from Minister of Health of Uganda, Uganda National Blood Transfusion Service, Mengo Hospital Rotary Blood Bank, and the Uganda Red Cross, Embassy of Eritrean Community Council in Uganda, UNHCR, African Humanitarian Action, Kampala Capital City Authority, Lugei Foundation, Hepatitis A Organization, the staff of East African International Medical Center, and all the members of Voluntary Blood Donor Association in Uganda, among all others from different organizations, attend these events under the theme Unlock the Potential of Urban Refugee Society as a key drive of community blood service in Uganda. It is an honor to stand before you representing the Eritrean Voluntary Blood Donor Association in Uganda as we gather here for the 11th round of blood donation just a week after the hosting Uganda for the 11th FSPT International Congress at Mengo Commonwealth Resort. I would like to express my utmost gratitude to each and every one of you for joining for those significant occasion. Please allow me to provide you a brief background on the association and the remarkable progress of our activities so far. The Eritrean Voluntary Blood Donor Association was established in Uganda by the founders with the noble goal of promoting culture of voluntary blood donation within the community. Our association, primarily formed by the Eritrean refugee based in Kampala, Uganda, stands as a testament to the unity and support that run deep within our community. On August 29, 2021, the Eritrean Voluntary Blood Donor Association in Uganda was officially launched under the umbrella of Eritrean Community Council in Uganda. Up to date, the association has organized events to aid individuals who have required emergency assistance at any given moment. Up to the 10th rounds of blood donor association event, the association has donated over 530 units of blood despite numerous challenges by coordinating with the Mengo Hospital Blood Bank. Since its inception, our association has witnessed tremendous growth and achievement. Our dedicated volunteers have tirelessly worked towards raising awareness about the importance of donating blood, not only within our community, but also among a wider population. Through various initiatives, campaigns, and partnerships, we strongly believe our association will strive to break down misconceptions, dispel fears, and encourage individuals to take part in this life-saving act. Our association success is determined not only by the quantity of blood units collected, but also by the impact we have had on the lives of numerous individuals. The willingness and generosity of our donors have directly contributed to save the life of those in need, including accident victims, surgical patients, and individuals living life-threatening illnesses and mother-child deliveries. Each donor of blood donated through our association is a symbol of hope, compassion, and unity. Moreover, the Eritrean Voluntary Blood Donor Association in Uganda serves as a powerful example of how a community, no matter the distance or circumstance, come together to support and uplift one another. Eritrean refugees in Uganda formed our association, showcasing the strength of our collective spirit, the deep-rooted value of solidarity, and our unwavering commitment to give back to the society. Today, we gather here to embrace our 11th round of blood donation. I am filled with gratitude for the continued support of the esteemed East Africa International Medical Center. However, we continue to seek support from other health ministries in Uganda, the Uganda National Blood Service, and other voluntaries such as the Red Cross to overcome our challenges in accessing donating units whenever our community requires blood. This support will enable us to store blood components just like other hospitals in Uganda through regular channels. Your presence here today is a testament to your unwavering dedications to the case of blood donation and your recognition of its immense significance in saving lives. In conclusion, I extend my heartfelt appreciation to each and every donor's volunteer and support of Eritrean Voluntary Blood Donor Association. Together, we have created a legacy of compassion and selflessness. Let us continue our journey hand in hand as we make a difference in lives of others through voluntary blood donor association. Let's save a replaceable life with
2011. How many?
blood. 11 rounds of Eritrean Voluntary Donor Association, Uganda, 16 March 2024. Thank you.
Thank you so much, Mr. Daniel, the representative from the Eritrean Voluntary Blood Donors Association. Ladies and gentlemen, we are on the 11th edition of the Eritrean Voluntary Blood Donors Drive, and this is held by the East African International Medical Center as the host. We would like to thank the East African International Medical Center for the services they are rendering to the Eritrean community in Uganda and also to Uganda as a country. Dr. Didas Namanya and Your Excellency, Mrs. Azeb Kidane Halo, the Head of Consular Affairs, the Embassy of the State of Eritrea. We worked with the East African International Medical Center in various campaigns. The recently concluded Buganda Community Engagement Medical Camp. It was conducted free. We managed, together with the East African International Medical Center, to work on almost 5,000 victims of people that came in to turn up for their services. Out of them, as the Hepatitis Consortium, we tested 1,300 people. We were able, under the services of the East African International Medical Center, they helped us to vaccinate 500 people in that campaign. And out of them, 35 of them were tested positive. These people were giving them guidance, counseling, and referring them for further medical treatment. We want to thank you so much, the East African International Medical Center, for standing with us under the campaigns that are helping the nationals of this country and also the Eritrean community in this country. We can clap for them, ladies and gentlemen. They're doing a great job for our country and also to the community of the Eritrean people. Blood donation, Mr. Daniel was here and he talked about the Eritreans who are donating blood. Ladies and gentlemen, it is not only here in this campaign that Eritreans are donating blood. They also they go an extra mile of moving to the Mengo hospital and they donate regularly, individually. We want to thank you so much for that love. He said you're doing it out of love, compassion, and unity. Pananga, we thank you. We cannot thank you more. Thank you so much for loving life and cherishing life, putting life on the next level. At this time around, allow me to invite Dr. Nsingo Simon Peter, the representative from the Mengo Rotary Blood Bank and also Mengo Hospital. So, thank you so much.
Thank you, ladies and gentlemen, all protocol observed. Good morning.
Good morning.
My name is Dr. Nsingo Simon Peter. I work at Mengo Hospital as the Executive Director or Medical Director. I'm pleased and humbled by your invitation to participate in this function as a chief donor. I want to say categorically that I've already donated my blood.
Yes. Thank you, thank you, thank you, thank you.
Blood donation actually is one of the things that remind us that we are humans. It's one of the ways that shows that irrespective of our tribes, our countries of origin, our religions, any other things that separate us, even gender, female and male, blood donation unites us that we are one person. The blood that you donate today as a person from another country can be used by a man, can be used by a woman, can be used by anyone. And that shows the connection that blood donation brings to us. Some people look at blood donation as a matter of charity, but for me I think it goes beyond charity. It is generosity. Being able to accept that every drop of blood that you give is useful because there's going to be that time when someone's life depends on that drop of blood that you have donated. And so for me, when I see you people coming here to donate blood, I look at it as a measure of generosity. You're stepping out of your comfort to see and realize that there is one person who is going to need your drop of blood for them to live again. I want you to think about the children that have had very bad diagnoses of cancer. And every day, in an interval of time, they're going to require blood for them to live. For their life to be extended by maybe a month or two, they need your blood to live. This gesture that you make to come here and donate blood is such a gesture of generosity. Think about people that have accidents in our roads in the country. And even as we move and we are healthy like this, the next moment, your leg is broken and you need that blood. Think about people that go to give birth. This is a natural thing. And then suddenly they need several units of blood. This is a gesture of generosity that connects us as humans, where we also have an opportunity to contribute to someone's living. And therefore, I want to thank you very much. As we come together in this blood donation, let us be compassionate and continue encouraging other people to continue being part of that drive.
Someone might be there thinking that these people are donating blood for their own. No, they are donating this blood to save us, all of us. The blood is taken in the blood banks to save Ugandans, to save the Eritreans themselves. Sometimes it might not even be used on them, but to the Ugandans. They love life, they honor life to that extent. Thank you so much for being that kind to our country and their nature of God. The representative from the Uganda Blood Transfusion Services, Mr. Michael Mukundane Chakamara, Coordinator of Blood Donor Services, is representing the Director of the Uganda Blood Transfusion Services. Thank you so much. You're welcome.
Ladies and gentlemen, good morning.
Good morning, sir.
Today is a great day. and I'm honored to speak before you here about this important exercise. I would like to begin by saying that the availability of safe, adequate blood to our patients with severe anemia out there depends on the generosity of all those that give it. And these are none other than the voluntary, non-remunerated blood donors. We thank you so much, those who have donated blood, those who have continued to donate ritually, and we also thank all those that have mobilized, that have engaged in mobilizing communities to donate blood. Your Excellency, it is very important that we recognize these people, that we thank them, that we also thank your government and your community that lives in Uganda here for the good work they are doing. It is about public-private partnership in this country. We cannot do it alone as the National Blood Bank. The Uganda Blood Transfusion Service is a department in Ministry of Health, charged or mandated with collection of blood. First of all, it begins with mobilizing blood donors, collecting blood, processing and testing it, and distributing it to all health facilities that are accredited to transfuse this blood to the patients with severe anemia. We can't do this alone. We need support of the community. And the biggest or the largest individual or the pillar in the blood transfusion service is a blood donor. And for this matter, we are proud all blood donors, here and outside, in Kampala and outside Kampala. And I encourage the Eritrean community to go further in those other districts and other places in this country to mobilize all those that are there, Eritreans and non-Eritreans, to donate blood. In the recently concluded African Society for Blood Transfusion at Mengo, in the Congress, in all the presentations they made, public-private partnership was there, involving corporate institutions, engaging communities like this by the blood donor recruitment and mobilization departments in the blood transfusion service was very much encouraged. In this case, I do continue to encourage it. Before I proceed, I would also like to give my apologies to you and personal apologies from my director who is out of the country, but who is well represented because I'm here to say what she told me to say.
Thank you.
The need for blood in this country is a dire one. Many times we don't have
How do we
blood,
say thank you in
especially the rare resources negatives are very rare. However, we have a data bank where I encourage many of you who are rhesus negative of any blood group to register with us, and from time to time we call you to come and save lives. If you know you are O negative, B negative, AB negative, please join us. We list you in our data bank so that we call you from time to time. I would like to thank my team from Mengo. The Mengo Blood Collection Center is under the Uganda Blood Transfusion Service. It is one of our teams that we have. It was sponsored by Rotary that built it. The staff belong to us. The equipment, everything they are using belongs to the National Blood Bank, to the government of Uganda. We have taken them on. But we thank the partnership with Rotary and with the hospital because of the cordial relationship to see that we are all aiming at one target. We all have one noble cause for this. The noble activity for a noble cause of saving lives. Blood unites us all, like the predecessor who spoke, the Mengo director. We need this blood. You can only feel you need blood when it has come to you. Unfortunately, many people do not know how important it is. You organize such campaigns, very few people turn up. But I'm very happy. The numbers are big. I hope we shall have blood is needed every other minute, every other second, because there is a patient out there who needs a smile, who needs a laughter that you can give.
Wow, thank you.
Blood is a gift of life. Please continue giving it to save lives. This is a great step you've taken. Continue with it. We shall support you. I see it's a very beautiful facility. It's a big one. I'm sure you told me somebody whispered to me you are processing transfusion services to be offered. We shall support it. We shall encourage it. We shall push it. We shall make sure you have these services. This facility does not only help the Eritreans here.
Yes.
If an emergency happens here,
Thank you.
I'm sure that, we have to run to the nearest health facility. Before you run to Mengo, before you run anywhere, you need to visit the Eritrean facility. And blood has no status.
True.
Whether you're the president of the country, whether you're an excellency, even if they're going to fly you in an aircraft ambulance, you may need to go on a blood transfusion in that ambulance. So the need for blood is secure. Blood has a shelf life of 35 days. What does that mean? That even if we donated 1 million units of blood today, they cannot be of use after 35 days.
True.
Meaning every other day we must go out to collect this blood. And when we collect this blood, it is taken to the blood transfusion services at Kampala Blood Bank in Central Region, where the testing and processing takes place. We also do component production, whereby we have to separate this whole blood into components according to need, like the platelets required by the cancer patients, like the cryoplastate, the red cells, the plasma. This blood is separated for different functions in these hospitals. So when we take it, we have to do all that. The platelets have a shelf life of 5 days maximum, and they can only be prepared from fresh blood. What does this mean? That every other day we must be out collecting blood. Whether it's a weekend, whether it's a public holiday, we must collect blood to prepare platelets for cancer patients, for the breeding cases of patients. The fresh frozen plasma, which has a long shelf life, is also needed for bleeding patients. So we need this blood all the time. We do a lot of work at the National Blood Bank. And we have the modern technology currently. We are using the nucleic acid testing. We have the NAT. We have that advanced technology that reduces the transmission infection window period. So we can assure you that our blood is safe. Please be assured that you are safe. We have been accredited by African Society of Blood Transfusion. We are at step 2 of accreditation. So our blood can always be trusted for any individual in this country. This blood is not only for Ugandans. Even people who come in as visitors, people who live in this country, people who visit our facilities, they may require this blood from time to time. We do a lot as a blood bank, and I want to thank my government of Uganda through the Ministry of Health for the work they are doing. Thank you very much, leaders, for representing the Director of Public Health. I want to thank the Association of Voluntary Blood Donors of the Eritrean. Thank you very much for joining me. Thank you for making my work easy. As a coordinator for blood donor services, I must make sure that communities are mobilized and blood is donated. So you make my work easy. When I have such an association, it's just a call away that there is a need. You mobilize me donors, voluntary and non-donated, they donate blood, and blood will be in the blood bank, and it will be accessed by the health facilities that do transfusion services. I would like to stop here. Sorry for taking a long time. And I would like to say thank you, and thank you. Your Excellency, thanks. And continue to thank the community of the Eritrean on our behalf. And pass on the message to the government that our working relationship is very cordial. For God and
Thank you. Thank you so much, Mr. Michael Mukundane Chakamara. He's the coordinator, Uganda Blood Transfusion Services in Uganda. Your representation to the director is absolutely 100% amazing and appropriate. We can give him a big round of applause. Thank you so much. At this juncture, allow me to request Mrs. Senate and Mr. Daniel, you can kindly exchange contact with Mr. Michael Mukundane. From what he has said, please, this association, I think we're also copying a leaf from this. We also need to establish in our areas where we live as Ugandans. We can have our locals, they can have like Bunga Voluntary Blood Donors Association. This is amazing, really. Thank you, the Eritrean. Your Excellency, we are honored and humbled with the existence of the Eritrean community in our country. They are doing us a tremendous goodies. We cannot thank more. Allow me, Yehanelna. Thank you. Allow me at this time, with a great honor, invite the chairman of the East African International Medical Center, Mr. Asmelesh. Kindly, Mrs. Helen, the CEO, you can escort Mr. Chairman and delivers the speech. Thank you so much.
First of all, I would like to thank our Lord Jesus for giving us this opportunity. And of course, honorable guests.
You can push the mic.
I have a very small thing to say, and the similarity of East Africa International Medical Center and this Eritrean voluntary blood donors. The similarity is just
I need to seek your guidance. These people are put on the program. They should be the embassy of the state, then the Ministry of Health. Is it okay?
From the community to the community.
The Excellency speaks first.
The first time
This one speaks. This is last. This is a big man. He's a president, my friend.
True.
This one comes. Then after this one.
Okay. Thank
You
you.
get?
Yes.
That's
That's why we
Let me
named
make him aware.
East African Medical Center. Currently,
Dr.
East
Kindly,
African International Medical Center.
I've been seeking
This
guidance that they have put you to come. And this day was supposed to have been speak.
Rooms, 3 rooms.
He's
But
been
now
dismissed.
we have
Okay.
occupied
Thank
all
you,
of
sir.
rooms
Yes, you're
at the
welcome.
moment. As the Eritrean volunteer blood donors in Uganda is funded by the community to the community. This East African Medical Center was founded the same way with the same vision. We have so far hosted above 20,000 people from all East African countries and hospitalized them
You're
with
going to
their
come
own
and speak about it.
language. Currently, we have Ugandan, Eritrean, Sudanese, and Somalian doctors working with us. The community has to sustain by itself, with itself. Just simple. This is a simple idea that we have. We used to be called by phone every day and every night from our community around us, just to go to a hospital and interpret for them,
Did you
so
know
that they will
this program
explain
you see?
what their sickness
It
is to their doctor.
This one
using
is a
English.
president.
This was a big challenge
She's
for our
going to
community,
speak last.
where we
She's
found
the
the solution
honor
and turned it
of
out
the
to be a
guided
big
by
vision
the
and
minister.
a mission to
She's
sustain.
the president where she
There has been
is. So I'm
some
going to
difficult,
tell
especially
her.
during
She'll speak
COVID,
to us.
and we were hit hard as everyone in the whole world. But still, we had a beautiful tomorrow. That tomorrow is the one which has kept us today, and that tomorrow is the one which has kept us to have a big vision. After COVID, we started again and started to make the facility bigger and bigger with more services to all community around it. That's when we met the Eritrean Blood Donation Association in Uganda. We approached and requested to host the movement
40.
to be a bigger blood donors by our initiative. It was when we started with a small number, and now, according to the records, we are one of the bigger blood donors in Uganda. Currently, from the whole Africa generally, and especially from East African countries, there is $300 million annually which are spent on medical tourism, and specifically
Can you come and
Uganda
talk
is
about
around
it?
70
Okay.
to 100 million tourism medical that is spent
Your
annually.
Excellency, good morning.
Good morning.
Yes.
I have a vision.
You are the guest of honor,
I can
and you are going to speak last.
No problem.
You are the president here.
Thank you so much.
Thank you, you're welcome. Okay.
I believe it only requires a desire to do it, a desire to dream big, and when you have a beautiful tomorrow, a tomorrow that you always desire, that you always to have. It's been 7 months now that we are proudly accredited international laboratory by GCC. It was not simple. We have worked hard. Every member of our in the facility is internationally accredited by GCC. We are located in 3 branches at Bunga, Endeavour, and here at the headquarters, Kampala, Uganda. We are working 24/7 at all facilities. I know it's a big and tremendous achievement for us to be accredited by GCC, but comparing to my vision, our vision, to stop medical tourism and being referral hospital from Eastern Africa, it's not yet started. So GCC, being GCC is not a simple thing, but the dream that we have is East African by East African, and to stop this medical tourism. Based on the achievements we had, we have participated in different community and health camp engagements, as what they have been explaining.
Absolutely.
In my conclusion,
You took the card.
I would love to thank the Ugandan
No, the other one for
government.
you hold this one. You took the other card for the ambassador.
And especially
Yeah, we are going to
also,
introduce her. She'll be the last guest of honor.
From KCCA,
Yes,
Ministry of Health, we have been helped and monitored and given
How I'm reading her name, is it correct? Azeb Kidani Hailu.
and trained us by KCCA, Material Division. So we thank every one of you, government of Uganda, people of Uganda. Thank you for the this opportunity and for hosting us. Thank you. God bless Uganda. Thank you very much.
Wow.
Thank you, the chairman of the East African International Medical Center. Can we give him a big round of applause? He talked about the GCC accreditation. Ladies and gentlemen, attaining that status is not easy. There are so many local hospitals struggling to get it, but credit goes to you, Mr. Chairman and the CEO, together with your team for the struggle to attain the GCC accreditation. Thank you so much. At this time, allow me to invite in Mr. Absalom to give us a guide on our different groups that we have and the details to follow. Thank you.
Thank you very much. As we all know, that blood is divided into several sections, like A, AB, and O, B. So we Eritrean community donating group, we have two kind of groups. For the most, the big one is holding about 640 members on it, which is on WhatsApp. They are gathered together so that whenever there is something, we just click and write something on there. Everyone is humble to respond and give life to other person. So this is a great thing. And also we have RH negative group, which is holding about 40 members on that, only RH negative, so that we cannot have any problem to identify who what needs. So that's a great job. Thank you for the members and thank you for the leaders of the community donation program. Thank you very much once again. Let's continue to the next question.
Thank you so much, Mr. Absalom is the manager, East African International Medical Center. Ladies and gentlemen, at this time round, allow me to welcome the representative from the government of Uganda, the mother ministry, that is the Ministry of Health. He's representing Dr. Chabayinze Daniel, and his name is Dr. Daidas Namanya. You're welcome on behalf of the government of Uganda to have us a word from the director. Thank you so much.
Good afternoon, everyone present here.
Good afternoon.
I will briefly go through the protocol. Her Excellency, the representative of the ambassador of the Eritrean state, representative of the UBTS, Uganda Blood Transfusion Services, the CEO, East Africa International Medical Center, representatives of KCCA, representatives of Mengo Hospital, representative of African Humanitarian Action, representatives of UNHCR, the refugee agency, the representative of Uganda Red Cross. I've seen some of them here. Rotary Club,
of Mengo, which is very key in organizing this function. Lugei Foundation, I don't know whether I've pronounced it well.
Very well.
Lugei Foundation. Then the Association of Eritrean Blood Donation Association, very key in this function. Ladies and gentlemen, all invited guests, good afternoon to you all. Today, I'm representing the Director of Public Health, Dr. Chabayinze, in the Ministry of Health. He sends greetings, warm greetings from the Ministry of Health, but he was unable to come. But he has given me a speech which I'm going to read to you. But before I read this speech, I want to make a few remarks about this blood donation and blood drive. I want to inform you, ladies and gentlemen, that in Uganda we have 7,889 health facilities at different levels. We have national hospitals, regional referral hospitals, health center 4, up to health center 2 in the villages. But even within the communities, we have what we call village health teams. That's how our health system is structured. And it is important for you to note that we have both government, PNFPs, private not-for-profit, like Mengo Hospital, and we have the private health providers, like the East Africa Medical Center. So that shows that we have cooperation between the government and the private sector, like the Medical International Center, which we are having here promoting blood donation. So of all these health facilities, your 3 health facilities are part of this number of 7,889. And we thank you very much for establishing these health facilities because they are providing services to Eritreans and Ugandans. And you are going to help us achieve what we call the universal health coverage. That's our achievement, our goal as government of Uganda. So that every citizen in this country, every refugee, every person who is in Uganda can access services as and when they need them. So we thank you for providing this initiative to start this center. Now, I'm going to thank you also for organizing and collecting blood over the years since 2021, up to 530 units. This is a great contribution to our blood, and it's always in need. We thank you so much for doing this contribution, and we want to encourage you to continue doing this kind of donation. Now that I've finished my comments, let me officially read the speech from the director. The speech starts with, good morning to you all. Well, now it's good afternoon. Good afternoon to you all. It's a great pleasure and honor for the Ministry of Health to officiate at this blood donation drive event. The theme of this drive, unlocking the potential of urban refugee societies as key partners and a key driver in community blood services in Uganda, is very suitable for this event. Blood is the greatest gift one can give to a fellow human being. Blood is a very important fluid that flows through our veins to transport minerals, energy, and also help maintain the body temperature in every kind of weather. Also, blood is very essential to help patients recover from surgeries, cancer treatment, chronic illnesses, and traumatic injuries like accidents on the road. And in Uganda, you know very well, we have many accidents, partly because of the sometimes bad roads, but there are many factors which cause accidents. So blood is very important for patients who suffer from injuries. Thank you very much.
Thank you so much, Doctor. You were talking about the Kenyeli. They told to me, I want to show you that I'm trying to cope up with the Eritrean. They said, Nelna. Thank you so much. Apart from the beautiful girls they also have beautiful hearts in them. They're coming together, especially voluntarily donating blood to save lives. You people, Nelna. At this time round, at the close of our closure, allow me at this time inform you that due to the importance of the donation of blood voluntarily, there is a mother, Your Excellency, there is a mother who has just given birth 5 months down the road. She had come also to offer her blood, but they have advised her not, but the love from the Eritrean community to save lives through donating blood voluntarily. I think that is a landmark. Thank you, Ma'am. Thank you so much.
Ladies and gentlemen, all protocol observed. Good afternoon. Today, I stand before you to speak on a topic that affects us all in some way, blood donation. Blood donation is a noble act of contributors to saving lives. Imagine a situation where a loved one requires blood and none is available. It is during this critical moment that blood donors become real life heroes. Their selfless service ensures that patients receive the life-giving blood they desperately need. Okay. Remember, every donation counts, and it is an act of charity. Let's celebrate World Blood Donor Day and continue to raise awareness about the importance of blood donation. It is our moral duty as healthy human beings to help someone and save their lives. Thank you so much. Have a nice day. ኤርትራዊ ኣብ ዝኸደ ኸይዱ ባህሉን ክብሩን ዓቂቡ ዝኸይድ ህዝቡ ምዃኑ ካብቲ ዘኽርዕን ክዕቀብ ዘለዎም ባህሊ እዩ። ምልጋስ ደም ማለት ከዓ መድሓን ህይወትን ክብሪ ንዘለካ ሰብኣዊ ሕልናን ዝገልጽ ስለ ዝኾነ እዚ ባህሊ እዚ ተዓቂቡ ክኸይድ እቲ ንኽርዓሉ ባህልና ክዕቀብ ሰብኣውነትና ንኻልእ ዓለም ክነርኢ ከምዚ ክገልጽዎ ዝጸንሑ ካልኦት ኮሚኒቲስ ኣለዉ እዚ ሶማላውያን ኣለዉ ካልኦት ካባኹም ክመሃሩ ክገልጹ ጸኒሖም እሞ ነዚ ባህሊ እዚ ክትዕቅብዎ ኣጥቢቐ ክላቦ ደሊ ክቡር ባህልና ክዕቀብ ከዓ ተካእቱ ንስኹም ስለ ዝኾንኩም ተስፋ ገብር ክቕጽል የቐኒየለይ።
Yes, good afternoon, ladies and gentlemen. Thank you for coming for the exercise. I would like to thank everybody who has just come here for this exercise. I would like to thank everybody who has just stand up for this exercise. This exercise is very important, especially to we people who are underserved, because you never know. We have people who are in the hospitals who are suffering because of lack of blood. So, for you who are well foresighted, I would like to thank you for what you have done. You never know, today is for somebody who's in the hospital and tomorrow is yours. We have very many people on the way there who normally get accidents and they always lack blood. This blood whom we always give goes to those people here. So for that matter there, I would like to thank everybody who has stand out for the exercise. Thank you.
Good afternoon, everyone. I'm Superintendent of Police, Aliru Stella. I'm the OC station, Kabalagala. I want to apologize for coming late. I had some work that I was doing, but I managed to mobilize some officers with whom I have come for blood donation. And I want to take this opportunity to thank the organizers of this blood donation. It is very important that we need to save lives. I was telling my officers, you might not have someone who is sick right now, admitted in hospital, but you can be a good Samaritan and save life. And on that note, I want to thank the Eritrean community so much for organizing this blood donation, and I want to thank all of you who have turned up for the donation. May God reward you abundantly, because it is a sacrifice. Many are dying in hospital, our brothers, our sisters. Personally, I have lost a sister who died because there was no blood in the hospital. So I always feel when there is donation, I should always come and donate blood. And I want to urge all of us, let us encourage our friends, our family members, people around us to donate blood where there need to be, because we need to save life. And as Eritrean community, we want to really appreciate you so much for the sacrifice. I know you're doing this for your brothers and sisters, and for us Ugandans as well. We want to say thank you so much. May God reward you abundantly. And as you're here as police, we pledge our support to you as the Eritrean community. Many of you have supported us in so many ways. In community policing, you've always funded some of our projects. We are so grateful to the Eritrean community. May God reward you abundantly. And when you have challenges, sometimes I call the chairman of the Eritrean community. Being a refugee, I know it is not easy, but we always try to help where we can. And whenever I see Eritrean communities in our custody, I make sure I get in touch with their chairman, and we see how we can help where we can. But Eritreans have been disciplined people in Uganda. We're working well with your leaders, and let's continue with the teamwork. Enjoy Uganda. We're a peaceful country, and we're your brothers and sisters. Just always feel at home. When you need us, anytime you need my support, my help, you can come to the office and ask for the office of OC Station or the DPC. We'll be in position to help you. Just once again, I've said I'm Superintendent of Police, Aliru Stella. For those of you who might need my contact for some other reasons or help, because many Eritreans have been conned or deceived, or for security reasons, when you need my help, please, you can have my contact, and anytime call me when you need help. Others already the other side for donation. They were so busy in office, but I begged them, I told them it is important, because we need to donate and save life. It might not be today, but tomorrow you'll need this blood. So thank you so much. Thank you so much.